Hey guys, the time is just about 5:15, and it was a really successful first day at clinicals, man. Really liked being at Watauga Medical. I actually feel like I'm gonna be a little spoiled, um, just because it was, dare I say, like a fun atmosphere. Like I said in earlier clips, I had seen like a couple COVID patients already by that point. um, had a really good conversation with my preceptor. Just concerning COVID and some stuff like that. Just stuff that I would actually like to talk about on this channel, but I really want to look into some of the studies and things that she suggested to me before, making content about that. But something that she did mention was um, just around the COVID nonsense is just, um, the tragedy of us allowing this sort of thing to divide us the way that we've let it divide us. Um, she was talking in a broad sense culturally, and that's definitely true. I've said it before, I'll say it again. I think it's really sad that we as the church are dividing over something that's, one, not connected to essential doctrine, and two, isn't really an opinion. You can have your opinions on mask wearing and stuff like that, but when you start pushing past that into the territory of COVID's a myth, like I said, bro, walk through the ICU and then you tell me that it's a myth, right? But I can talk about some other things that I did. Got a couple of ABGs, that's arterial blood gas readings. We drew them up. I drew them up, I should say, through an arterial line. So I kind of got a bit of a easy mode on arterial blood gases, but it was still pretty cool just to work with the tech. Um, did some airway cuff management. I know it's basic stuff, but like it's nice to really start putting my hands on stuff in the field. I did a crap ton of patient assessments just throughout the day. Just anytime I walked into a room, I was like, okay, let me listen to my patient's lung sounds. Let me look at their neck to see if they've got any JVD, to see if they've got any tracheal deviation. Let me just look at the general appearance of the chest. See if there's any expansion. See if there's any barrel chesting going on. Let me look at their extremities. Which you might think doesn't really matter that much in pulmonary medicine, but it does. Let me see if they've got any extremitous edema going on, any swelling. Might be first signs of some fluid that's going to back up into the lungs to come. And also just assessing the general perfusory status of the patient, whether or not blood's getting where it needs to go. And like I said at the start of this, let me listen to those lung sounds, bro. I want to hear if you're breathing clear. I want to hear if you're breathing labored. I want to hear if you've got any wheezing going on. Is it wheezing when you breathe in, wheezing when you breathe out? I had one patient today where it was wheezing across both inhalation and exhalation, right? That's inspiration and expiration for us in the field. I like talking medicine. I like this is a Christian Bible channel. Why do I spend the time talking about medicine? Well, a couple reasons. One, breaking down misconceptions, right? Attacking that misconception that Christians can't do good science, that Christians can't be intellectual. Well, you've got to wrestle with me and people like me. I'm not unique. I'm not special in that way. Secondly, just to help Christians kind of work through and process their theology of healthcare and sickness, right? To actually process their theology of healthcare and sickness according to a biblical worldview, one that Jesus would actually espouse, not a biblically superstitious worldview, right? And you know the difference, right? Biblically superstitious, just stitching verses together, whereas a biblical worldview is actually taking the context of what Scripture is wanting to say and is actually saying, right? Instead of just reading your own superstitions and fears into the text. You're reading out God's security, God's provision, God's providential running of creation through ordinary means. You're reading all of that out of the text. You know, so I mean, it's good stuff, man. As you can see, got myself a hotel room for the night, just because I do not feel like trying to make that morning drive back up to Boone. I mean, that was a disgusting drive, bro. Like, thickest fog I'd ever seen, nasty switchbacks, you know, on the mountain, can't see the shiny doodads in the road. You know, so I'm driving like half the speed limit. Meanwhile, the locals are all zooming past me, just going zoom, zoom, you know, going like 60. When I know they can't see, you know, it's like people at the hospital are like, yeah, you know, they just drive off memory of the road. And I'm like, that's no good, man. Like, it's no good, bro. You know, so I mean, that's day one. I got myself a pizza coming from Hungry Howie's. And just gonna chill out. You know, got my case study. My case study's already done. We have to do a case study on a patient every week that we're at clinicals. I'm gonna attempt to try to get my case studies done the first day of clinicals, so that way I can just focus on having fun with patient assessments and just, you know, getting comfortable with things in the hospital, getting comfortable building a foundation, you know, a skill set of foundations, right? Just like on the ambulance, right? Get your patient assessment in, get used to, you know, just get used to conversating with the patient, right? Start building up your personality, your persona as a healthcare provider, right? Just start getting those basics lined up, so that when we move on to more advanced stuff in year two, it'll be just like, you know, it'll be just like slotting my cards into my wallet. You know what I'm saying? So that's all I got for day one, man. I'll catch y'all tomorrow morning as I'm leaving the hotels. I'm checking out of the hotel for day two of clinicals here in Boone. Foreign Saint, Kari Rowe, peacing out, man. And look out for next week's Bible study in Luke. It's gonna be good stuff. All right, peace for now. All right, hey people. Oh geez, what is the time? Time is 17:55, 5:55, and I just made it back home from my clinical rotations in Watauga. Man, it was a really fun 2 days, man. I spent a lot of time in the IMCU, which I don't know what it means because I forgot to ask, but I've had to guess. I feel like that's the intensive medical care ward. Don't quote me on that. But do quote me on the fact that we was dealing with a lot of COVID patients today. Just a lot of different presentations of it. And there are a lot of different presentations of COVID that are out there. This disease is weird, man. Weird. Big shout outs to both of my both of the clinical proctors that I had over the weekend, or I say weekend, over these 2 days. It felt like a weekend because it was fun. There we go. But yeah, big props to both of them. Just for, I mean, it's always really cool when you get really, really good proctors, you know, that let you actually be, you know, hands-on and challenge your understanding of things. Up to that point, just kind of push you to, you know, understand more, because, you know, I mean, the goal is to be able to provide the best quality care, you know, that you can to people that are in, you know, really fragile, that are in really fragile, many times really scary for them situations. So I mean, you gotta know your stuff. That being said, that kind of brings me to one of the things I really liked about today. Was just the number of times, the number of times I said I don't know was so refreshing. So refreshing to say I don't know, and like that's not just okay, but it's expected. Just with everything going around, there's always a temptation to act like you know more than you do. There's always a temptation to give an opinion on something when you don't have an opinion to give. Like, just say I don't know. And even cooler for me, I mean, I know a lot of people probably wouldn't think that this is cool, but I really do think it's cool. Just how open it was to be able to say I don't know as a student in front of a patient. That to me was really cool. Because it's always been my opinion that I can trust the statements of people who are willing to say I don't know, because when they do tell you something, when they do say I know this, you can have a bit more confidence that they've researched it out, because they'll also admit when they don't know something, so you know that their ego's not wrapped up in these things. Next clinical vlog is gonna be in a week when I'm at a different facility, so when you see me there, you'll see me there, man. And I got another video, I plan to do another video as on the topic of how to afford clinicals, and I guess in a bigger sense, just a respiratory therapy program, a medical program in general. Just some some tips, some tricks, some wisdom that I've learned. Some of this I've learned just from the Bible. It's there for everyone. Some of this other stuff is experiential. Nice little 5-10 minute video just talking about that, right? So if you're in the medical field or thinking about it or know someone who is, whenever that video drops, send it their way. Until next time, man, I'm gonna get me some food, hop on my PlayStation, man, and just chill out for a bit before jumping back into life and getting ready for my shift on an ambulance tomorrow night. So until then, I'll catch you next time, y'all. Oh, and also keep in mind, I say this in every other video because I love it so much, man. Luke Bible Study is coming up. Luke Bible Study is going to be coming in the next couple of days. Stay tuned for that. Until then, peace.